Confusion, seizures, people hospitalized after taking veterinary drug for COVID. It's a drug that's been supported by some conservative media figures, but taking ivermectin to treat or prevent COVID-19 might land you in the hospital, a new study warns. Interest in the drug surged last summer as the highly contagious Delta variant took over the United States. But instead of protecting against the virus, the use of a medicine typically reserved for horses and cattle has instead prompted a spike in calls to poison control centers across the country. In response, the U.S. Food and Drug Administration has warned against using the drug, stressing that no form of ivermectin has been approved to treat or prevent COVID-19. The Pfizer-BioNTech vaccine booster restored close to full protection against COVID-19 in a late-stage trial involving 10,000 people, the company announced Thursday. They said the booster was 95.6% effective and that they plan to submit the latest data to the U.S. Food and Drug Administration and regulators in other nations. These results provide further evidence of the benefits of boosters as we aim to keep people well protected against this disease, Pfizer chairman and CEO Albert Bourla said in a statement. Antibody infusions help keep high-risk COVID-19 patients out of the hospital, but getting the therapy can be a challenge. One U.S. health system has found a creative way to address the problem: home infusions administered by paramedics. Researchers found that the tactic was feasible, delivering antibody infusions to 144 COVID-19 patients in their homes over 3 months earlier this year. Most, about 95%, avoided hospitalization for worsening COVID-19 symptoms. While COVID-19 hospitalizations have been declining recently, the United States is still averaging more than 6,600 new hospital admissions for the infection each day, according to the U.S. Centers for Disease Control and Prevention. When people at high risk of severe COVID-19 do contract the virus, there is a way to lower their odds of ending up in the hospital: an infusion of monoclonal antibodies. Monoclonal antibodies are lab-engineered proteins that are similar to the antibodies the immune system churns out to fight infection. Those used against COVID-19 are designed to recognize the spike protein on the SARS-CoV-2 virus. The Pfizer and AstraZeneca coronavirus vaccines reduce the risk of death from the Delta variant by 90%, a new UK study finds. The Delta variant is now the dominant form of the coronavirus in the United States, the United Kingdom and many other countries. The study collected data from 5.4 million people in Scotland between April 1 and September 27, 2021. Is the first countrywide assessment of the effectiveness of vaccines in preventing death from the Delta variant. The Pfizer vaccine was 90% effective and the AstraZeneca vaccine was 91% effective in people who were fully vaccinated but tested positive for the Delta variant, according to the findings published October 20 as a letter in the New England Journal of Medicine. AstraZeneca's vaccine is not available in the United States. Deaths from COVID-19 were defined as anyone who died within 28 days of a positive PCR test, or who had COVID-19 listed as a cause of death on their death certificate. The Moderna vaccine is also available in Scotland, but no deaths have been recorded in those who've received both doses, so it wasn't possible to estimate its effectiveness in preventing death, the researchers noted. They also said that the findings need to be confirmed by replicating their research in other countries/settings, and with longer follow-up after full vaccination.